Well, friends, welcome to today's session, and we are honored to uh, provide the Rita Sood Oration Award to Dr. Chetna Desai. She is a very well-known personality amongst our medical education circles, and she is currently professor and head Department of Pharmacology at BJ Medical College, Ahmedabad. She is my batchmate in 2000 batch of Hamer Fellowship and has been associated with a large number of activities since then. She is a co-faculty for FACE and RFACE programs, and she and also she is a resource person for developing the online prescribing skills training course for Indian medical graduates, developed and implemented under Indian Council of Medical Research, New Delhi. She has served as chief editor of Indian Journal of Pharmacology, January 2013 to 2017, the official index journal of Indian Pharmacological Society. She has been the associate editor of Indian Journal of Pharmacology also from 2006 to 2012, and she has contributed to question banking of National Board of Examinations since 2015. She is a member task force in medical education, Government of Gujarat, and she has conducted large number of workshops at various themes of health professional education. She is a coordinator for Regional Training Center and Adverse Drug Reactions Monitoring Center for Pharmacovigilance Program of India in BJ Medical College, Ahmedabad. And besides this, she has been in a large number of expert groups, member of the NMC expert group for revision of the curriculum for MD in pharmacology, Secretary International Indian Pharmacological Society, and she has received the S.B. Pandey Oration by Indian Pharmacological Society, and Dr. P.K. Carr Memorial Oration from the Odisha chapter of IPS, and Anand Datta Prize for Best Published Paper Award by Indian Pharmacological Society, and S.C. Verma Memorial Prize twice for Best Paper Presentation at Gujarat State Level Conference of Indian Pharmacological Society. I mean, she is a very, very active member since a long time. And over to you, ma'am.
Thank you, Dr. Bedi, and a very good evening to all who have taken that time out to attend this oration. I chose this topic of health professions educational research in India. And at the outset, I would really like to thank Dr. Bedi, Dr. Singh, sir, and all those who have thought me apt for this very prestigious oration. My association with Madam's late Professor Sood started since 2007 when we first met, I mean, even at CMC Ludhiana. And ever since, I have been a silent, sort of, observer and a fan of Madam, not only for her erudite, learning that she displayed, but also for her very soft and gentle nature and a very friendly approach. We never used to feel like there is a distance between her and us. And in the process, because of that, we learned a lot from her. I had the good opportunity to meet her on several occasions at the NCHPs, at the FRIs, etc. And also at whenever I visited All India Institute of Medical Sciences, it incidentally happened that she would, her office would be on the same floor as our Department of Pharmacology. And when she knew that I was visiting, she would, just take some time off her busy schedule to just have an informal chit chat with me. And that since then it has been like we would look upon her as a very eminent, of course, educationist, but also as a wonderful human being. Today, I chose this topic of educational research for several reasons. Ever since I stepped into this, I would call a zone of medical education or health professions education, and ever since I did FAMER and then I was into the ACME, I realized that, of course, I was doing a lot of biomedical research too, but I realized that educational research is also one more area where our country needs to develop. And especially when you're talking about bringing about changes in the education, be it medical education or health professions education in general, it needs to be backed by some evidence. And both FAMER and ACME gave me immense opportunity to, actually look at educational research in a very new light and also follow the, various contributions done by several of our educators in this area. So what exactly is educational research? I don't think I need to really tell a lot about this because most of the participants, as I see, are already into educational research. But basically, just to start the ball rolling, it's an application of scientific and discipline inquiry to the study of educational problems. So basically, what here too, just like in biomedical research, here too we have a systematic process of collecting data, analyzing them, interpreting them, so that we are able to link the problems to appropriate solutions, as in the context of education. To be more precise, health professionals educate. So eventually, it may facilitate change in local practices, policies, and shift from opinion-based teaching to evidence-based practices. So, for example, a very common example I would give is like we all perceive that PowerPoint is a very good way of teaching learning tool. But whether it is really so or is the Blackboard better? So instead of having just an opinion, it's always better if you have some evidence to generated evidence, to prove or disprove your opinion. So basically, the primary purpose of educational research would be to address the problems arising during the process of curriculum development, implementation, and management. Now, why do we really have to do a research in HP education? World all over, or at least in India, there is a lot of perception that doctors don't have time, number one. And there's a lot of patient load, even on the basic sciences, there's a lot of administrative work to do, etc., etc., etc. And we have to do some amount of research in our own respective subject. And added to that, why should we really bother about health professions education? Well, basically, we say that HPE would provide research, would provide teachers and in fact all the stakeholders with the systematically obtained information that helps improve the quality of learning process and outcomes. But currently the way HPE research is, as in India, we are not really looking at what is going to be its impact in terms of, is it really going to produce a better Indian medical graduate or specialist or health professions education in general in our country, or ultimately the patient care, is it going to improve when we are going to implement our findings from the educational research? So we still haven't evolved to that stage, but I'm quite confident and positive that sooner or later we'll be doing that. Now, India has seen a drastic and dramatic change in medical education in India. And here I'm talking about medical education because most of the dramatic changes have occurred in medical education. But as I see today, even the other health professions are following the queue, and they are also, coming up with similar types of initiatives of improving the standards of their respective educations in India. So it's not just about the numbers. If you see the graph here, the number of private as well as the government medical colleges over the years have increased dramatically, and that perhaps is one of the reasons for this is the perceived low patient and doctor ratio. But here there is also the concern regarding not just the quantity but also the quality. So there has been a felt need to enhance the quality of medical education in the country. There's a growing recognition of that, the fact that educational research is likely to improve the medical teaching and learning. And as a result of that, or as a result of, these initiatives, which occurred through various fellowship programs, the training programs at JIPMER, the ACME program by the NMC, specialized courses, various types of training workshops and conferences dedicated to promoting research in health professions education, as well as specialty conferences, which are having a segment of for promoting educational research in their respective specialty. Because of all these individual and collective efforts, we are seeing a sea change not only in medical education in India or health professions education in India, but also the educational research component of the education. So here I would like to, we talk about a new concept which I've read somewhere. I forgot to cite it here. But as a pharmacologist, we know this word half-life very commonly come across this term. We say that what is the time it takes for a quantity of a drug to reduce itself by half the original quantity. Nowadays, people are talking in terms of knowledge also, that they say there's half-life of knowledge. So previously it was about 1.5 to 2 years. So supposing a concept has developed today, it's for at least 2 to 3 years that a concept will stay true and stay put. But now it is seen that the half-life is also reducing, and the educational research fuel is now then fueled by the demand for skilled healthcare professionals who are able to adapt to this rapidly changing concepts. So all these various factors are eventually bringing us to a situation where ER is going to become a sort of, important component of our professional lives. However, let us face the fact that the current focus and direction of educational research in India is not very clear. We see so many educational research projects, we see so many publications, but we don't see a definitive focus, nor do we see all these educational research taking us forward in one common direction. Currently, I'm not trying to, being negative, but currently our educational research projects are ruled by our perceptions and practices rather than the actual need of focus areas. For example, I would take up a project because I identify with it, or I like that idea, not because my institution might need it. So the day we look at it from the actual need, what is the need of focus area, that time I think our educational research in India will be more mature. So currently I would call ourselves to be an exploratory phase. We are evolving, but as we all know that all evolution, whether it is the Darwin's evolution or any other evolution, usually takes us to a positive change. And that is what I foresee for educational research in India also. Now, to prepare specifically for this particular oration, I actually looked into the various publications that are there on the PubMed. You might ask me why. Well, we know that publications are a direct metric of educational, any research, in fact. So at least we would say that 30 to 40% of research projects convert themselves into educational, into publications which are published in reputed, databases like PubMed, etc. So, of course, it wasn't possible for me to go through the entire, database that is there in Google Scholar and other, but I chose PubMed, and I chose a time span of 25 years, roughly from 2000 to 2024. And I came across more than 480 original research articles on PubMed, which of articles that are published for research carried out in India and related to health professions education, which to me is not a small number one. Secondly, there was also a very nice, beautiful graph which showed that all this growth which took place, majority of the growth has taken place in the past decade from, let's say, 2009, 8 and 9 to 2024, so decade and a half. And when I looked at the various topics for educational research that the various researchers have indulged in, we had a variety of topics starting from teaching learning strategies, learning styles and strategies, assessment tools, then clinical skills teaching and assessment, e-learning, educational environment, program evaluation, professionalism and ethics, curriculum development and implementation, especially after 2018 and 19, we see lots of educational research projects coming up on that. Mentoring and stress management. We know that stress is a very big issue for health profession students, professionals in general. And lately, we are also seeing some good amount of research going on program evaluation, and interprofessional education. So these were the various, focus areas. But as I mentioned earlier also, that these were all taken up by individual researchers based on perhaps their own perceived interest. How much they are really going to, how much will they be really able to transform into something that is going to be useful for their institutions or for the country as a whole, that remains to be seen. Now, I came across this nice article by Dongre and Deshmukh in Journal of Research in Medical Education, which actually did a systematic review of medical education research in India. And they did a year-wise distribution of, they did an analysis of original research articles published from 2007 to 15. And they, after, after shortlisting 71 publications which met with their criteria, they did a further more detailed analysis. And here you would see the evidence of what I was speaking about, that the publications basically were few and far in between 2006 and 7. But if you see the jump in the number of publications to nearly 43.6%, these are the numbers and these are the percentages in 2014 and 15. Of course, this study was only till 2015. The articles taken till 2015. The study was published in 2019. So, if you see here that the majority of the published, papers came during the 2013 to 15, which means that this is the time, or a little earlier than that, that educational research really started taking shape in our country. That is what I would like to believe, because there was no other way by which I could have really, researched more into this, because unless I'm able to, determine what are the various projects carried out in the different institutions. But I think this is a good enough metrics to determine the extent of educational research, the type of educational research that is taking place in India. The topics that were in this particular study, research topics that had preference or that were given preference were small group teaching and large group teaching innovations like team-based learning, problem-based learning, CBL. We know that these are the very, areas of concern as well as interest of most of the researchers. And of course, faculty development. And then there are other topics like training in research for UG students, community-based teaching, curriculum development, student assessment, skills building, mentorship, stress management. And there are lesser areas like research workshop. How does it really have an impact on PG research, integrated teaching, a couple of projects on that, distance education, foundation course, web-based learning, and then miscellaneous surveys, etc. One more thing that we observed from all of these papers, or even the papers that the research projects that we saw earlier, is majority of these were either in the form of surveys, or questionnaire-based type of studies. I'm coming to that later. So the target groups for most of these educational research projects were understandably UG students, undergraduate students. Several reasons can be there for them. One I perceive is that majority of these are very important stakeholders for whatever educational interventions or innovations that we carry out. And secondly, the fact that undergraduate students are more easier to, research on than faculty and other students. I mean, that again could be my perception. Again, I need to generate evidence for that also. Then, of course, the faculty perceptions and questionnaires which are targeted to faculty, that was another group. And then there are lesser number of studies that were targeted to interns and PG students, and that is where we need to work on in future. These researches were spread out in different specialties. And of course, the basic sciences took the bigger cake. Community medicine, then physiology, anatomy, biochemistry, pharmacology, or forensic medicine, of course. Quite a few number of researchers, they attributed or rather acknowledged the medical education units and FAMER programs for their research projects. So, which tells us a lot about the contribution of these programs and advanced course in educational research. And of course, there were good number of publications and researchers also coming from the clinical departments, but of course, lesser as compared to the other specialties. As I mentioned earlier also, most of these were surveys or research, and qualitative design was used by very few, and most of these were coming from community medicine. And most of the types of surveys and studies designs were quantitative in nature. Mixed methods were used by 18% of them, and most of these, 90% of these education research projects were single site. They were not collaborative or multi-centric type of studies. So this type of survey does tell us that what is the type of education research happening and how it can be made better, and what could be the areas where we could develop further. Now, let me at this point of time clarify that all these inferences that I have drawn so far are based on articles that I see on my desktop coming from PubMed and other index journals, and maybe from some predator and non-index journals also, because they do appear in the Google search and on the Scholar. But there is a major chunk of educational research, I believe, that is carried out by several of our colleagues and peers, which are there and not out in the open, but they have been presented somewhere as posters and informal presentations, but obviously not peer reviewed. Some of them, like which are completed works and projects to be published someday. In fact, in my own office, I have a couple of them, and they're still lying as a bunch of papers to be published someday. So when it is not shared, it is not done, something like that. Some of them which have been rejected and then not seen the light of the day. And then some which are just ideas and discussions, but which I hope will see the light of the day someday. So what we need to work on as educational researchers is that how to bring out this big chunk, into the open. And how, for all you know, many of these ideas and discussions, many of these completed projects may be quite valuable and important to shape our educational research in our country. So we must find out ways and means to see how we can really bring out these into the open and encourage the educational researchers to, share their findings with the community of health professions educators. So these are a few snippets that I came across. These are the informal poster presentations that have been made. There are several, in fact. If you just look at the ACME program, for example, every 6 months, we have so many posters coming out. Same is true for FAMER programs. And then we have the specialty conferences in which education research projects are also put up. Nowadays, they have a separate section for these type of projects. So there are several of them. Then, of course, we have the published ones. So I have classified them into some themes. For example, as I told earlier also, that the teaching learning strategies took the biggest chunk of all the educational research projects. Now, here I would like to just clarify that I haven't really selected any particular author or any particular, publication. Or if I have left out any, it is very much unintentional. I just want to just give you an idea regarding what are the types of projects that are being carried out. The only commonality between all of these searches that I have made is that they have been carried out in India. They have been carried out by educational researchers in India, and these are all original research articles, right? So if you see, there could be teaching learning strategies. There are various types of studies have been carried out. For example, clinical reasoning skills of PG students in internal medicine, then jigsaw technique for students, and what is the impact of learning portfolio and reflective and communication skills in UG dental students, then how does pre-reading affect the learning outcome, then what is cinema education, how does it affect the learning professionalism and ethics in medical students, and so many other types of, and of course the flipped classroom, which is, actually a pet topic for many of the educational researchers, and then WhatsApp assisted learning, another very commonly researched topic, whether it really has any impact versus a traditional classroom learning. This study was carried out by us, where we did a crossover study of 2 different teaching learning methods in UG medical students. Then, of course, there are papers on assessment methods also. Again, let me clarify that these are only research articles. There are several other review articles, several other commentaries also, which are very valuable source of information. But since we are talking of educational research, I have taken those where some research has been carried out and that has been published. So we have this, amongst the assessment method, I found that the MCQs and the OSCEs and mini CX, these are the ones which are really the pet topics for most of the researchers. And a lot has been done into MCQ assessment also, as an assessment tool also, regarding how many types of options are better, how does faculty training improve the quality of MCQs, then also what is the, how does OSPI help, in improving the objectivity in assessment, then does the faculty training really impact the quality of MCQs, which type of MCQs are better, etc., etc. So there are several such type of studies that have been carried out. Now, since 2019, we see a lot of education research projects which are related to curriculum development and implementation. So we all know that the competency-based curriculum actually came like a hurricane to all of the medical educators. And it was a totally new concept. It was not just, old wine in the new bottle. It was actually a new concept. And there was a lot of, resistance for the faculty to adapt this. And that's why several educators, they actually did good amount of research in the form of surveys and questionnaires, where both the faculty, especially the faculty and the policymakers, were interviewed, or rather they were asked to fill out surveys. And then what are the enablers, what are the challenges which are faced, etc., etc. So we have some publications in this area, like stages of concern of medical faculty towards adoption of CBME, then challenges and opportunities in implementation, then exploring the faculty perspectives of CBME. I personally feel that these studies are going to be really helpful in the long run, considering the fact that already the 2019 batch of student is going to now clear I think already cleared their final MBBS. And when they go out into the field and once the CBME is going to be implemented even in the postgraduate curriculum, and when these postgraduates are going out in the field, perhaps we are going to really know the impact of this CBME on the patient outcomes and the society. So this initial research that is carried out in this area is very valuable, and it has actually brought out several pros and cons, which I think need to be actually conveyed to the National Medical Commission also, so that we can make the appropriate changes wherever required. There are several researches being carried out on the foundation course and other components of foundation courses. Incidentally and interestingly, one of the earliest research on faculty development was done by none other than late Dr. Sood, Professor Sood, and it was regarding the faculty development and medical education units in India way back in 2009. But later on, as we know that faculty development has been an important impetus for implementation of CBME, and it's a compulsory component of any medical college nowadays. And this has helped us to implement CBME very quickly and fast. How effectively, that only time will say. But several of these researchers have focused on how good is the faculty development, number one. How has the faculty development really impacted the CBME, implementation of CBME, and also other components of the education. So we have various types of researches, like improving educational environment in medical colleges through transactional analysis practice of teachers, the need and priorities of faculty development for medical teachers in India. Then there is a very nice paper on how does a fellowship program, FAMER fellowship program for faculty development, how does it, what's the impact on self-efficacy beliefs of health professions? It is a longitudinal study. And then there are other studies like how the ML web sessions are helping in what are the faculty views on CBME, etc. So these type of educational research projects are also being taken up. Then, of course, we know now that in the CBME and in the foundation course also, there's a lot of focus on ethics and professionalism. And also, mentoring is becoming an important component of the undergraduate medical education. And we also know that mentoring is now compulsory or mandatory for all medical colleges. And a very positive development, I feel. And then again, here too, people have researched on that, on whether the existing what is the need assessment of existing mentorship program among UG medical students. That's an experience from a medical college in Chhattisgarh. Then there was introducing mentoring to first year medical colleges in a private medical college in North India. And then what is the perception of medical ethics, so on and so forth. So as we mentioned earlier also, that concepts are introduced, practices are introduced, opinions are built up, but now these are being converted or into education research project, and we are coming out with some conclusions or certain observations which may or may not go with what our opinions say to us. Now, the other health professions also have not been left behind. Thanks to, I think, FEMA, and also thanks to a sort of ripple effect, I would call it, where similar types of initiatives are being taken up in physiotherapy institutions and the respective councils, in the dental councils, as well as nursing colleges, and even the CAM, that is the complementary and associated alternative medicines. And we have some very good researches being carried out in those other health professions also. And then there have been certain very good projects carried out for interprofessional education also. And these also have seen the light of the day in the form of publications, but which also gives us an idea that we need to move beyond our own profession, that is medical education or dental education, and try to link ourselves with the other health professions also. Because eventually when you talk of patient care, it's not just you cannot talk in silos. And that is where, for example, some of the researchers have talked about enhancing communication skills among residents in India, an interprofessional educational approach. And then we have similar type of studies carried out in dental institutions regarding perceptions of students and faculty of a dental college towards student evaluation of teaching, so on and so forth. So we are having educational researchers coming out from these other institutions as well. I mean, other specialties as well. Now, there have been educational research which has been, when we talk of educational research, whether it is health professional education research, it is generally considered to be very generic in nature. You can't have a sort of something called pharmacology education, or you cannot have something called surgery education. We basically have all the concepts are quite generic in nature, but we are seeing that educational research has been focused in certain specialties also. And the good thing about this is that the various specialty journals, for example, they are now dedicating some areas in their journals, or some sections in the journal, or even supplements in the journals, only to publish the educational research that is being carried out. Now, that is of immense use for us, because if, let us say, there is some practice of, let us say, OSPE or anything in anatomy, I may have to do it in pharmacology, then I may have to modify some of the components for my own specialty, right? The basic fundamentals being the same. So that, and also when it is published in, or whether when the specialists, your co-specialists know about the education research being carried out, then there is a wider dissemination of whatever work that has been done. So we have evidence of educational research being carried out in various specialties. I have mentioned just a few of them in pharmacology, because it was easier for me to locate them and also relate to them. But in fact, I have come across educational research being done in almost every specialty. No specialty has been left behind, whether it is surgery or psychiatry or community medicine or biochemistry or pharmacology or anatomy, anything you see. And same is true for other health specialties also. COVID-19 was a very important period for education in India. Important in what terms? Many of the education institutions were closing down, students were at home, and the period that we were facing was a very long one. And we couldn't have left the students alone, right? And some type of learning would have happened. And no doubt, the National Medical Commission took its own initiatives to see that the learning continues after a lull of about 3 or 4 months. And this was the time when, no doubt, e-learning and digital learning and online learning was there earlier too. But this was a time when these tools of learning became very much, more commonly used. And people, especially the faculty who were not at all conversant with using, for example, a platform like WebEx or Zoom, they became, experts in that. And then a tool like WhatsApp became one of the important, resources for learning. So obviously it was like the next step was, let us research into how effective it has been. What are the difficulties faced? How can it be made better? So on and so forth. Many researchers and even the educationists thought that after COVID-19, this e-learning and the digital way of learning and the online way of learning will die out. But even today, we are sitting here and, listening to an oration on Zoom platform, right? So lots of research actually happened during COVID-19, which was related to education. For example, what is the role of social media use in e-learning amid the COVID-19 pandemic? Then how can smartphone apps in UG medical students help you? Or then medical education during COVID-19 associated lockdown. What is the faculty and students' perceptive, etc., etc. I personally feel that these type of projects that were carried out not only helped us in understanding these tools better and using these tools better, but it also helps us to perceive that in a difficult situation also, how is it possible or what strategies one can adapt to see that, you continue with your learning without, having gaps, and still the quality of learning is not affected, or does it get affected? So God forbid, if we are facing a similar crisis in future, at least we are 50% prepared, and we have some evidence gathered from our experience and the research that has been carried out. So COVID-19, of course, we have lots of publications, a lot of research that was carried out during COVID-19, and some of which I have mentioned here. So you may ask, or rather the doubt that comes to our mind is, why only after, say, 2008 or 2009? I'm not saying that no educational research happened before that. But I think there were some enzymes, I would call them enzymes or impetus, which actually suddenly caused a spurt in educational research in our country. For example, one of the reasons I would say is National Medical Commission. It says that publications are needed, 2 publications are needed, right? And then it made it till 2009, it was just desirable, but later on it was made mandatory for promotion of teachers. Now, I don't know whether it is a very good step or not, but I have definitely seen a lot of change in the teachers' attitude after that at least they are going to work for the 2 publications. Okay, we are seeing increasing predatory journals and some very not so good research carried out is a different matter. But even then, if you have 100% of the faculty doing some research, be it biomedical research or educational research, we still have some good amount of research coming in, right? And of course, then they said that 30% of the faculty should be trained in ACME, and ACME, one of the important components of ACME is a research innovative project. So that is, which is going to transform into a poster and hopefully into a publication. So this was another impetus which gave for educational research in our country, right? And thankfully, in 2019, the criteria for specialty journals was also removed. And that, I think, also encouraged multidisciplinary other specialty research, other than specialty research, a lot, And of course, FAMER and FAMER regional institutes, they have a very big role to play. We have 4 FAMER regional institutes in India from 2005 onwards. And one major component or emphasis on it is the educational research and educational scholarship, which has in fact given out very good projects and very good educational scholarship products in our country. It's not just about that, but the networking that it provides also helps the faculty to, keep doing that research even after they have completed the FAMER fellowship program. And then, of course, this was a comparison of project focus across all programs, which was carried out by Dr. Rashmi Vyas et al. This is for the FAMER fellowship program, and she has sort of done an analysis of all the FRS across the world And if you see here too, the main project areas, focus areas have been educational methods and student assessment, curriculum revision and integration change for CMCL, FEMA Regional Institute. Similarly, program evaluation, and then we have interprofessional education for, that was a focus for Mahe Philip, that's quite understandably so. And PhD FRI also, the main focus area was educational methods and student assessment, curriculum revision, integration, and change. So it does give us an idea about the direction in which educational research is going in our country. So there's a very beautiful article that we can all learn. And of course, not to undermine the efforts and contributions made by other programs related to health professions educations in our country and other health profession education specialties in our country towards educational research. So what I call is, I always call myself as an accidental teacher, because when I entered into the MBBS in 1981, I never thought I would be a medical teacher. No grouses and no regrets about that. But I personally feel that the transformation from accidental teacher to somebody who is able to revolutionize HP, and I'm not talking just about myself, I'm talking about all those teachers and accidental teachers in health professions educations. Majority of this revolution that we see is, I personally feel, because of two reasons. One is educational research, and second is the faculty development programs. And this, the way is only going to be upwards and positive. Now, is it easy to carry out educational research? Basically, educational research, people get put off by ER. The answer to this is yes and no. Let us see why. Now, all those who have done their educational research will be familiar with this particular story adapted from Larry Gruppen et al. And this is a research story which sort of brings an analogy between biomedical research and educational research, and what are the similarities and differences between the two. And basically, the analogy that it builds up is that we need to conduct a research on rats about how the brain is affected as a result of exposure to an imaginary airborne infectious virus. And there, the analogy is that the subjects here are the students. The labs of the rats in biomedical research are actually the institutions and the classrooms. And the virus that we talk about is the educational innovations. But it's not just a direct analogy, but because of this, we are able to understand educational research better, which says that the educational research is a soft science research approach where there are certain ifs and buts, and there are certain do's and don'ts. And basically, it says that unlike biomedical research, which can be done under controlled conditions, the educational research happens in the complex learning ecology consisting of different stakeholders, and not only within the college environment, but as well as from the external regulatory environment, right? So whether you are carrying out an educational research or biomedical research, the process and the accuracy and is going to, when the steps involved are going to be more or less similar. Just because it's a soft research, we don't simply undermine educational research. But answering the question of whether it is easy to carry out, the answer can be yes and no also. So what could be the plus points for carrying out educational research? One is that it allows for interdisciplinary collaboration. It allows for diverse perspectives and expertise to be integrated into research projects. Secondly, it's very easy for the HPs to have access to clinical environments, thereby providing opportunities for authentic research experiences and direct applications of findings to the practice. Third is, you have a potential to improve teaching and learning outcomes in HP and better patient care and healthcare outcomes. So it's a little bit of an altruistic feeling also. Fourthly, it also helps to enable the professional development of the HP itself, and it fosters a critical thinking, problem solving, and scholarly inquiry. It provides opportunities for networking amongst the various researchers, and I feel it is not very resource intensive. For example, setting up a lab and getting expensive instruments is more difficult than doing an educational research in a classroom. Okay, but there are some problems. One, and the most important, is a time constraint. Certain resource limitations may be there. The most importantly, the access to participants may be an issue, because we have to, sort of coordinate the timetables. We have to look at the availability of the faculty or the stakeholders. And after all, they are human beings. with their own, ideas and their opinions. So they are not rats. So it's not necessary that they would, just say yes to whatever you have to tell them. And of course, that brings into fact the ethical considerations also, where institutional review boards is required in most of the education research projects, but somehow for some good reason, the IRBs are not able to appreciate this fact. And hence this conflict constantly keeps happening between the researchers and the IRBs. Nowadays, of course, the things are changing. And then the most important is we are not trained to do educational research. The tools that are there, the methods that are there, what do you mean by validated instruments, what do you mean by validated methods, etc., etc. But this is one complexity which can be easily, not easily, but it can be overcome by appropriate training, And last but not the least, whatever you find out or rather test your hypothesis and come to conclusions from your educational research project cannot be generalized for varying settings. This is one major difference between educational research and biomedical research. But if you are aware of this limitation, then it does not become a sort of disabling factor for carrying out educational research. So what's the way forward? Most of the public research I told you mentioned is about innovative teaching learning methods. We talk of validated questionnaires and surveys, but really, do we know how to do validation? That's a moot question. Also, most of the studies are done projects are being done on student assessment, programmatic assessment, e-learning, and digital platform. When you're doing program evaluation also, people are not going beyond Kirkpatrick level 1. What was the focus on? Learner satisfaction or faculty satisfaction. What we need to go see is the subsequent effect on patient outcomes, Kirkpatrick levels 2, 3, and 4. That is where our education research now needs to go. And also focus on PG training, PG assessment, internship, on slow learners, and using methods beyond survey and quantitative analysis that we need to, have more deeper focus. And for that, I think specialized training of the faculty may be required. Then eventually, what is the impact of these various interventions and innovations on the IMG? Do they really affect the selection in PG courses? Do they really affect the quality of IMG? Do they really determine the patient outcomes? We still don't know. We still don't know, honestly. What about the internship and postgraduate courses? What about the educational environment? We talk of implementing an innovation, etc. And on the other hand, we talk of student absenteeism. So where is the connect between the two? Are we working in silos? Are we really being able to transform our learning and our research into something that is applicable, right? For example, when you evaluate a drug, let's say a beta blocker or a new monoclonal antibody, eventually it comes into the market. It or its one of its congeners does come into the market as a useful drug. But here we still are not able to really forecast or rather say whether it is going to be useful or how useful it is. That we really need to work upon. And then we also need to focus, as I mentioned earlier, on poor performance. Then, of course, the challenges in implementation, acceptance of adapted curriculum is one more thing. Then about the selection exams, how good they are, how we can adapt, how our students can adapt to that. How, more importantly, how can faculty adapt to this selection, what type of research is required in that. Then we also need to focus on collaborative and interprofessional research. We need to really focus on educational environment. It is changing so rapidly. And unless we as faculty and educators adapt to this educational environment, which is changing rapidly, we may be left out. How do the students make their career choices? What are the student placements? How the student placements are impacted by the various innovations that we carry out? Is there a need to change the accreditation process? Is there a need to change the parameters for faculty assessment? So these are all the areas where we still need to work on and we need to research. In India, we have very few medical journals with open access, which are considered to be good journals in medical education. Journals which are available abroad are not always open access. We need to build networks and inform each other. And, the tip of the iceberg needs to become bigger rather than majority of lying underneath the, water surface. You need to build a repository free for use. You need to have special training to the faculty for educational research. And eventually, just like through faculty development program, We are trying to increase a critical mass of trained health professional educators. We also need to increase the critical mass of health professional educators who are also researchers in education. But last but not the least, after doing that or while doing that, we need to come out from the ivory towers to the classroom. How can we make academic researchers useful to the real world? So how do we accelerate the learnings from the academic research and demonstrate their usefulness in the real world? That, I think, is my major concern at present. But again, as I told you, that we are evolving, and somewhere we are in the middle of the reaching that zenith. And if we keep these in mind, and if we are focused about what are we doing and why are we doing that? Why are we carrying out a particular research? And eventually, what is going to be its long-term impact? Be it a small innovative practice or being a program evaluation or anything, then I think our educational research is going to be even better. So we need to, work upon the different methods that we are using. We need to work upon our focus areas, and we also need to look upon the long-term outcomes of the various educational research that we are carrying. But all said and done, ever since 1980s, since I started my career in as a medical educator till date today, the graph has been upswing, and it has been a really good development that has been happening, and I'm quite positive for educational research in India in future too. Thank you so much for your kind attention, and thanks again to the organizers for inviting me today.
Thank you, Dr. Chetna, for the excellent session.
Thank you.
And on behalf of MEU India, we feel honored to present to you the Dr. Rita Sood Memorial Oration Award. I mean, it was a wonderful session, and there has been a very active chat, especially your suggestion of bringing out the repository. I mean, very grateful to you. And in an oration, we don't ask sessions, but I'm very tempted to. So anyway, so I mean, it was a very, very comprehensive session, and I'm sure we will be able to implement many of the suggestions given by you, especially making it meaningful to these masses and the patients. And so thank you very much. The session has been live streamed on YouTube also, and the recording will be available there.
Thank you.
Thank you.
Thank you once again for this opportunity. It was good learning for me too. Thank you.
Thank you.